The late 1990s was a time where energy gathered for access to essential medicines for the poor. Many of the developing countries were just coming out of the big debt crisis, and AIDS was ravaging Africa.
Tuberculosis is one of the most important global health problems, ranking among the top few together with HIV/AIDS and malaria.
There had been almost 50 years with almost no action. So we saw an opportunity that history was providing to us.
So it is time for us to emerge from hibernation, to advance TB innovation and develop regulatory processes that can deliver innovation more quickly to the people who need it most.
20 years ago, it was only through the foresight of over 100 organizations who dedicated themselves to coming together and discussing and really deciding what was needed to turn the field around. And with the Cape Town Declaration in the year 2000, we had that beginning.
We were a skeleton crew. We didn't have a lot of resources. We had energy, we had faith, and we knew that it had to be done.
It was a bold experiment in 2000. And the meeting in Cape Town brought together a number of important organizations. We all began to put together a model for how the different organizations could work together to identify promising compounds and provide the resources and expertise to advance them for new drugs. And it worked.
Mel walks in the room, and we're sitting there again working on this grant, and he plops his papers on the table, and he says, "You want innovative? Okay. So we're not going to go for drug development in the normal way. We're going to go for combinations."
You can't treat people with single drugs, and if we try to develop one new drug at a time, and only after we get each individual drug license start combining them, this is going to take forever, and it doesn't really make sense in terms of patient care. So we should start talking about developing regimens, and it kind of seemed self-evident once he said it, but nobody else was saying it at that time.
We have made significant progress. All of this has evolved basically over the past 20 years. We shouldn't underestimate the progress of the past 20 years. We shouldn't also underestimate the challenges that lie ahead in the next 20 years.
For me, the investment case is realer than ever because we've made such progress. And in my mind, that now is the time to double down on that investment, not to step back from that investment. At the end of the day, this is about having a goal. The goal is to end epidemics. It's to cure diseases. That's the job we've got to do, and that's the job we've got to go forward doing with better tools today and future tools of tomorrow.
Clearly, we would not be able to accomplish anything that we accomplish if we didn't have the financial wherewithal to do that. And for that, we are certainly indebted to all of our funders. But the one group who are the most important of all are the patients who volunteer for the clinical trials that we are dependent on. The patients put their lives on the line. I don't know what more you can ever ask of a person. We wouldn't be here without it.